Module 10, Chapter 21. Now that you've become an expert in the cardiovascular system, we're going to turn our attention to your next organ system for this semester, your lymphoid system. And when you're talking about the lymphoid system, it brings to light this idea of immunity. So we're going to be talking a little bit about that as well. Now when you start thinking about protecting the body, there are two different ways to do it. One is through non-specific defenses. Now, a non-specific defense prevents or slows the entry of an infectious organism or attacks the infectious organism upon entry. Now, non-specific defenses are present from birth, and they don't have the ability to distinguish between threats, meaning that these defense mechanisms basically attack everything the exact same way or block everything the exact same way. For example, your epidermis, that beautiful stratified squamous epithelium that you learned about in A&P1. That nice keratinized multi-layered structure is a barrier. It basically covers the entire body in this impenetrable barrier that blocks out bacteria, viruses, mold spores, parasites, chemicals. It's just a very generic barrier, and it's a barrier to everything. It doesn't pick and choose what it's going to be a barrier against. So the epidermis of your skin is an example of a non-specific defense. However, sometimes you do have to use what's called specific immunity. Specific immunity involves your immune response. Now, the immune responses develop after birth as you are exposed to pathogens in the environment. Now, in the immune response, you're going to be using your lymphocytes. And lymphocytes have the ability to attack specific pathogens. So one type of lymphocyte might only attack one type of bacteria, while the next lymphocyte attacks another type of bacteria. So think of the lymphocytes as not multitasking. They're designed to attack and kill one thing and one thing only. So lymphocytes with this very specific ability to attack pathogens allow you to have the ability to resist specific infections and disease. So specific immunity is very important for your body's defense. Now, when you start thinking about the lymphoid system and its components, there is a unique fluid flowing within it, and the fluid is called lymph. Lymph resembles plasma, but it has a lower concentration of protein. You have lymphatic vessels, which are unique because they actually begin in body tissues, and then they end at veins. You have lymphoid tissues. A lymphoid tissue is not surrounded by a connective tissue capsule, which is different from a lymphoid organ, which is surrounded by a connective tissue capsule. So lymphoid tissues and organs are only different by the nature of are they surrounded by a connective tissue capsule or not. You then primarily have two major types of cells within these tissues and organs. You have your lymphocytes, which are providing specific immunity, and you have phagocytes, which are those really beautiful generic eaters. They're going to perform phagocytosis. The phagocytes provide non-specific defense because they just eat things that do not belong. Now, let's talk about the functions of your lymphoid system. The first, fluid recovery, was touched on in the last chapter. Your lymphatic vessels are responsible for absorbing the 15% of extra fluid not reabsorbed into a blood capillary, and then eventually carry that fluid back to the blood itself. Now, this recovery is going to help maintain your blood volume, but also help to eliminate variations in the chemical composition of your interstitial fluid. The fluid recovery mechanism also helps to transport lymphocytes, defensive cells, and defensive proteins from organ to organ, which improves the ability of the lymphoid system to protect you. This system is going to provide you with your immunity. Your lymphocytes, again, have the ability to respond to the presence of specific foreign antigens and pathogens. This system is also involved with lipid absorption in the small intestine. There are specialized lymphatic capillaries called lacteals. These lacteals are responsible for absorbing your dietary lipids and bringing them into your lymph for transportation back to your blood. Now, your dietary lipids would include all of the different lipid types that you learned about in A&P1 and your lipid-soluble vitamins, your vitamins A, D, E, and K. Now, this lymph that I mentioned previously, with regards to its composition, it's clear, colorless, very similar to plasma, but fairly low in protein. And its composition will vary from place to place depending upon the chemicals in the extra fluid that the lymphatic vessels have absorbed from the tissue. So we're going to start our tour through this system by looking at your lymphatic vessels. And the very first lymphatic vessels that I want to mention are your lymphatic capillaries. Lymphatic capillaries are very different when you compare them to blood capillaries. As you can see here on the screen at the top, you've got an arterial on the left, a venial on the right, and you can see the capillary bed highly branched connecting the two. And then interwoven between these capillaries, you have these green structures, kind of looking like kelp or seaweed in the ocean. These green structures are your lymphatic capillaries. The lymphatic capillaries actually start as blind-ended pockets, meaning each lymphatic capillary just magically starts inside the tissue. Now that's different from blood capillaries because blood capillaries are connected to an arterial at one end and a venial at the other. The fact that lymphatic capillaries just sort of begin and have this unattached end is very unique. Your lymphatic capillaries have larger diameters than your blood capillaries. Their walls are made out of simple squamous epithelium, and believe it or not, that simple squamous epithelium is even thinner than the simple squamous epithelium forming the capillary walls. Now, blood capillaries have a nice round, regular outline. Your lymphatic capillaries, however, have very flat, irregular outlines. Now, in the lower image, which is what you want to be looking at next, I want you to look at that single lymphatic capillary and look at the endothelium. Look at the cells forming its wall. These cells actually overlap on their ends. And this overlapping mechanism actually forms a valve-like structure. And this valve allows fluid to flow into the lymphatic capillary, but it cannot flow out of the lymphatic capillary. So in blood capillaries, couldn't fluid go either way across the wall? You could filter out or reabsorb back in depending on pressure. In these capillaries, fluid only has one option. It can enter. So once you've gotten into a lymphatic capillary, you are now stuck inside that lymphatic capillary. Now, these capillaries are present in almost every body tissue, but they are absent in some areas. For example, the cornea and lens of the eye, you don't have any. One, they are solid structures. They would block light from coming into the eye. However, if you don't have blood capillaries in your lens and cornea, there's no filtration happening, so there's no extra fluid to accumulate and remove. So these capillaries are not even needed there. You don't have them in your epithelial tissue or your cartilage for the exact same reason. Those two structures don't have blood capillaries, so you don't run that risk of having an accumulation of excess filtered fluid. You also don't find lymphatic capillaries within your spleen, your red bone marrow, or within the central nervous system, which means if you do accumulate any extra fluid within the tissue forming the brain and spinal cord, you have no natural way to remove it, which is why they'll surgically implant shunts to help drain excess fluid when necessary. From your lymphatic capillaries, lymph is going to flow into what are called collecting lymphatic vessels. Now these collecting lymphatic vessels have all three layers in their wall, similar to arteries and veins, except these layers are actually thinner than even in the veins, and they do have valves, in fact more valves, inside them than veins to prevent backflow. Now there are two different classes of collecting lymphatic vessels. You have superficial lymphatic vessels, which are located superficially, so they're going to be on your surfaces. So for example, they're in your subcutaneous tissue, which is directly deep to the skin. They're also found within the areolar connective tissue of your mucous and serous membranes. Recall from A&P1 that mucous and serous membranes cover the surfaces of body cavities and organs. You also have deep lymphatic vessels. Deep means that these are not going to be located on a surface. In fact, these are going to accompany the deep arteries and veins of your skeletal muscles and of the organs within the neck, limbs, and trunk. You'll even find these within the walls of your visceral organs. Now, all of the lymph from your superficial lymphatic vessels and your deep lymphatic vessels are going to drain into things called lymphatic trunks. Lymphatic trunks drain major portions of the body. These lymphatic trunks are going to merge together to form what are called lymphatic ducts. And there are two major lymphatic ducts in the body. The first one I want to mention is your right lymphatic duct. The right lymphatic duct empties its lymph directly into the right subclavian vein. The right lymphatic duct receives lymph from the right upper limb, the right side of the thoracic cavity, and the right side of the head and neck. The thoracic duct is a lot larger. If you look at the upper image, the thoracic duct starts at a structure called the cisterna chyli. It's a wider sac-like structure located at the level of lumbar vertebra 2. From L2, your thoracic duct extends up the vertebral column, so it's running along the bodies of your vertebrae, and it empties its lymph into the left subclavian vein. Now the thoracic duct basically receives lymph from everywhere else. So it's receiving lymph from the right side of the head and neck, the right upper limb, the right side of the thoracic cavity, and all of your structures located inferior to the diaphragm. Now, before we go forward, I did want to mention lymphedema. Lymphedema is a special type of edema, so that tissue fluid swelling, resulting from issues with your lymphatic drainage. So for some reason, potentially due to a blockage in lymphatic drainage, there's a blockage in one of your lymphatic vessels, your interstitial fluid begins to accumulate. Now, this particular type of edema is very serious because you run the risk of having uncontrolled infection. Think of it this way. Your interstitial fluid basically is stagnant because your lymph flow, as mentioned in the last chapter, provides a flushing action, and it can flush bacterial toxins and other hazardous chemicals out of your tissues. If you block lymph flow, you lose this flushing action, and the toxins and the pathogens can actually begin to accumulate and overwhelm all of the local defense mechanisms within the tissue. So your infection now can spread uncontrollably. And all of this infection is spreading without the ability to activate your immune responses because you're not carrying your pathogens to a lymphoid tissue or organ, which are needed in order to get that immune response activated. So, out of all the different types of edema that you could possibly have, this is the one that you really do not want because of this high infection risk. Now, let's talk a little bit about lymph flow. Lymph flow requires a lot of help because your lymphatic vessels receive no pressure from ventricular contraction. When your ventricles contract and create pressure, that pressure is then transmitted into your arteries, capillaries, and veins. Your lymphatic capillaries don't begin at the heart. They begin out there in a body tissue. So your heart does not contribute any pressure to help promote lymph flow. So the pressure in the lymphatic vessels is even lower than in the veins, and your lymph velocity, the rate of speed, is lower than in your veins as well. So in order for lymph to flow, you're going to need a lot of different factors working together. For example, there is rhythmic contraction of the lymphatic vessels. I mentioned that they do have the 3 layers, aside from the capillaries, that is. The other vessels do have the 3 wall layers, as in arteries and veins. They're just a lot thinner. So these vessels do have a tunica media, does have a little smooth muscle, so they do have the ability to contract, especially when the lymph inside them stretches them. So if you accumulate lymph, it stretches the vessel and that triggers the smooth muscle to contract. There are one-way valves that do help to make sure that once the lymph moves from one body area to the next, that it can't flow backwards. The skeletal muscle pump that is utilized by your veins, so when your skeletal muscles contract and compress the veins, they also compress your lymphatic vessels to help milk your lymphatic vessels and improve your lymph flow. Most of your lymphatic vessels are next to arteries, and you've learned that arteries are very muscular. They can contract. So arterial pulsation actually can compress the lymphatic vessels next to it, helping to promote flow. The same respiratory pump that you used to help pull venous blood from the abdominal cavity up into your thoracic cavity and then push it into your right atrium, well, that respiratory pump is just generally creating pressure gradients, and those pressure gradients can help move lymph within your lymphatic vessels as well. Also, the flow of blood within the subclavian veins helps. The rapid flow of blood in the subclavian vein actually produces a little suction that helps to pull lymph from the lymphatic ducts and into your blood. Now let's talk a little bit about the different cells that you find in the lymphoid system. T cells, also known as T lymphocytes, form 80% of the circulating lymphocytes. T lymphocytes are born in your red bone marrow, but then mature in a lymphoid organ called the thymus. Now, there are 4 main types of T cells. The first that we're going to talk about are your cytotoxic T cells. Cytotoxic T cells are going to provide you with what is called cell-mediated immunity. Now, cell-mediated means that the cytotoxic T cell itself is going to be protecting you. It's going to be attacking and destroying what doesn't belong. In cell-mediated immunity, your cytotoxic T cells are going to target cells with intracellular pathogens. So that means that the pathogen has physically entered the body cell and is reproducing within it. These could be cells infected with a virus, bacteria, yeast, protozoans. However, the cytotoxic T cells also attack things like worms, spontaneously formed cancer cells, and transplanted tissues. So your cytotoxic T cells basically can recognize when a cell is sick, and a transplanted tissue does not look, those cells don't look like yours, and these cells view it as looking sick, something that needs to be destroyed because it has a pathogen within it. Now, helper T cells are going to promote the action of your cytotoxic T cells. So think of helper T cells as turning on the cytotoxic Ts. Helper T cells will also help to activate your B cells as well. Regulatory T cells serve to help limit your immune response, so they have a way of turning off or decreasing the functions of these protecting cells. However, they're very poorly understood, and what they do is very highly debated in the scientific community. You also have memory T cells. Now, these are T cells that actually form from colonies of cytotoxic T cells. And what the memory T cell is responsible for is providing a memory of that pathogen, so that if you ever encounter the pathogen again, these memory T cells can recognize it very quickly, initiate an immune response very quickly, and actually get rid of the pathogen before you even potentially have symptoms or even know that you've been sick. So think of the cytotoxic T cells as protecting you against an infection you have right now. That this infection these infectious pathogens have invaded cells of your body, and the cytotoxic T cells are killing those infected cells and the pathogens within them. The helper T cells are going to help to turn those defenders on. The regulatory T cells are going to perhaps turn them off when your immune response is no longer needed. And the memory T cells are going to linger in the body for years, providing your body with a memory of the pathogen so that you can defend yourself more quickly the next time. B cells, or B lymphocytes, make about 15% of your circulating lymphocytes. Now, they do provide immunity, just like the T cells. However, they provide it in a different way. They're going to provide what is referred to as antibody-mediated immunity. What this implies is that the B cell itself does not do the killing. However, the B cell is going to, when activated, transform into a cell called a plasma cell. The plasma cell then produces antibodies, which are defensive proteins, and the antibodies will bind to the pathogen or foreign antigen, deactivating it and marking it for destruction. So it is immunity, it is a way to attack specific pathogens, but the cell itself is not doing the attacking, it's the antibodies produced that do it. Now, B cells and specifically the antibodies that they produce are going to be very good at attacking extracellular pathogens. So things that are on the outside of your cells. So viruses in your interstitial fluid, bacteria in your interstitial fluid, yeast and protozoans in your interstitial fluid. The antibodies can even help you get rid of non-cellular pathogens. So things like toxins, venoms, allergens, those things can also be marked by an antibody for removal from the body. Now, there are memory B cells that are created when your B cells are activated, so that if a pathogen comes in that you have had before, the B cells have the ability, thanks to the memory B cells, to recognize that pathogen and initiate a much faster immune response. Now, unlike your T cells, B cells do mature in the bone marrow itself. So B cells are born in and mature in your red bone marrow. Remember, the T cells, as I stated before, mature in your thymus. You then have natural killer cells, which are abbreviated NKCs. They are the remaining 5% of your circulating lymphocytes. And what these cells have the ability to do is they have the ability to provide you with immunological surveillance. So they travel throughout your body looking for cells that are abnormal. And these natural killer cells are designed to attack any abnormal cell. So they'll attack and destroy bacteria, transplanted tissues, body cells that are infected with a pathogen. They'll attack cancer cells. So basically, if the cell screams, "I'm not normal," they can kill it. Now, these natural killer cells are not providing you with immunity, because each natural killer cell will attack anything that is abnormal. Remember, with immunity, it's one lymphocyte attacking just one type of pathogen. Natural killer cells are non-specific defense. They attack anything that's abnormal. They don't look and say, "Oh wait, you're a bacteria, I'll kill you. Oh, you're a virus, I'll let you go." They attack anything abnormal. It's only the B cells and the T cells that provide you with immunity. That's specific defense. Our next lymphatic cell is the macrophage. Now, macrophages develop from monocytes that have moved from your blood and out into tissue. So, just like a monocyte, macrophages are phagocytes, so they're going to be eaters. And they have the ability to phagocytize debris in your tissue, dead neutrophils, bacteria out in your tissues, etc. So, great at eating and removing, which is very non-specific defense. However, they also act as antigen-presenting cells, or APCs. What this means is when your macrophage phagocytizes a pathogen, let's just say a bacterium. Now, that bacterium is brought into the cell. The macrophage's lysosomes are going to merge with the vesicle, with the bacterium, going to chop the bacterium up, completely destroy it. But it's going to take some of the antigens from that bacterium and actually ship them out to the plasma membrane and present those antigens on the outer surface of the plasma membrane. Now, once those antigens are out there, the cell presents them to T cells. And by presenting them to T cells, you're alerting them to the fact that there is a pathogen that needs to be destroyed, and your immune response can kick in. Dendritic cells form kind of the same function. They act as antigen-presenting cells. However, they do not perform phagocytosis. They're going to use receptor-mediated endocytosis to bring the pathogen into the cell. Now, dendritic cells are mobile, just like macrophages. You can find them in your epidermis. They're present in your mucous membranes, and you'll find them in various lymphatic organs. Reticular cells are stationary antigen-presenting cells, and they also contribute to the framework inside your lymphoid organs. All right, so now let's talk about your lymphoid tissues. Recall from earlier that lymphoid tissues are considered tissues, not organs, because they're not surrounded by a connective tissue capsule. Some of your lymphoid tissues are referred to as diffuse lymphoid tissues. The reason they're referred to as diffuse is the fact that the lymphocytes are scattered instead of being densely clustered together in larger masses. Now, some of your diffuse lymphoid tissues are classified as mucosa-associated lymphatic tissues, or MALTs. The reason they're referred to as mucosa-associated is that you find them in the mucous membranes of passageways open to the exterior. So they're found in the mucous membranes of the respiratory tract, digestive tract, urinary tract, and reproductive tract. Other lymphoid tissues are referred to as lymphoid nodules. Now, in a lymphoid nodule, the cells are going to congregate or aggregate in really dense masses. And the lymphocytes can actually come and go from these nodules as pathogens enter and your immune responses are activated. Now, they're almost always normally part of your lymph nodes, your tonsils, and your appendix. We're going to be talking about those structures soon because they're classified as lymphoid organs. So you do have lymphoid nodules that are part of your lymphoid organs. You also have some separate lymphoid nodules that sort of exist on their own. They're referred to as aggregated lymphoid nodules. The old eponym for them were Peyer's patches. And these aggregated lymphoid nodules are found associated with the ileum, which is the distal part of your small intestine. So if you think about it, one of the ways that you can get sick is by eating pathogens. So your digestive tract puts you at great risk for infection. So having these aggregated lymphoid nodules near the ileum, the distal part of your small intestine, you're providing defense to the body in case you've ingested something harmful. Now, when you're dealing with lymphoid organs, you are looking at lymphatic tissue that is surrounded by a connective tissue capsule. So just by adding that little outer covering, you are now an organ. And there are two different classes of lymphoid organs. Primary lymphoid organs are where your B and T cells become immunocompetent. Now, immunocompetent means that the cell has the ability to recognize and respond to antigens. So think of it as gaining your ability to attack and defend. Now, your primary lymphoid organs are your red bone marrow and your thymus. The remaining lymphoid organs are referred to as secondary lymphoid organs. Once your B and T cells are immunocompetent, they will migrate from your primary lymphoid organs to a secondary lymphoid organ and then remain there and wait, basically, for a pathogen to come in that they can respond to. So, as I said before, your red bone marrow is considered to be a lymphoid organ because this is where your B cells are going to develop, mature, and become immunocompetent. And in fact, all of your formed elements do originate in the red bone marrow, including the T cells, but they become immunocompetent in the thymus. Now, your lymph nodes are another group of lymphoid organs. Okay? These are considered to be secondary lymphoid organs. They are actually positioned along your lymphatic vessels. So as your lymphatic vessels are extending through the body, periodically they will run into a lymph node. And lymph is going to enter your lymph node through what are referred to as afferent lymphatic vessels. Your lymph is going to filter through the lymph node and then exit the lymph node through efferent lymphatic vessels. Within the nodule, and there is one-way flow through the nodule. There are valves in here so that once the lymph comes in, it's guaranteed to exit through the efferent lymphatic vessels. There are many different types of cells in your lymph node. You have reticular cells, which, as you just heard, are stationary APCs. They also produce reticular fibers, these highly branched interwoven proteins. These reticular fibers actually help to filter your lymph, and they provide structure to the lymph node. You have dendritic cells and macrophages, which are antigen-presenting cells, but they also perform phagocytosis, non-specific defense. And you have T cells and B cells to help provide immunity, to help provide you with immunity. Now, with regards to what the node is going to do, it's going to help to purify your lymph. It is estimated that 99% of all of the impurities within your lymph is very effectively removed as it is passing through the lymph nodes. And this is important because you want to purify your lymph before it enters your venous system. Also, by having your lymph pass into the lymph node, you actually create an early warning system to any infection or abnormality that might be existing out in the body, because those pathogens are going to head into this node where you have B cells and T cells. Now, lymph nodes are strategically located in vital areas that will help to protect the organs of your trunk. So you want to make sure that your heart, your lungs, your liver, your stomach, you want to make sure that all of these vital organs stay protected. So if you start thinking about where these nodes are going to be, you're going to find them where your lymphatic vessels attach to the trunk or your torso. Because where are you most likely to be injured? Upper limb, lower limb, head and neck. Those lovely appendages that just happen to get in the way sometimes out there in the world. So you're going to find lymph nodes in the axilla. So remember your axillary region, your armpit. These lymph nodes are going to help to filter out pathogens that are coming from the upper limb towards the torso. You have a cluster of them around the base of the neck, so where the neck attaches to the torso. So if you've got a pathogen that has somehow gained entrance in the head and neck, it limits its spread to the torso there. Also in your groin or inguinal region. So if you have a pathogen that has entered the lower limb, it can get filtered out before entering the torso. You also find them lining within the mesenteries of your digestive tract. Mesenteries are sheets of supportive connective tissue that help to hold your organs in place. Your trachea, which is the main airway heading to your lung passageways have lymph nodes. Also, your thoracic duct has lymph nodes associated with it. If you think about that thoracic duct, it started at L2. It's receiving all the lymph coming from the lower limb, the pelvic region, and it's traveling all the way up through the abdominal cavity, up through the thoracic cavity. And it's collecting all that lymph. So it could potentially contain some really nasty pathogens that you want to pull out before the lymph is dumped into your left subclavian vein. So you want to make sure if you have ingested or inhaled a pathogen that you've got lymph nodes in those areas to help protect you. Now let's talk a little bit about your thymus. The thymus is a bilobed organ in your mediastinum. It's very large in infants, but it atrophies with age. The maximum size of your thymus is about 40 grams, and that size is reached just before puberty. After puberty, the thymus actually starts to break down. It degrades until it's only approximately 20 grams by age 60, and then it really rapidly decreases in size from 60 forward, which is why elderly individuals are more susceptible to disease, because if this gland is dying, this is where you mature your T cells. So if the gland dies, you can't produce the T cells that you need to provide you with cell-mediated immunity. So you're going to have trouble dealing with intracellular pathogens, viral infected cells, which is why elderly people can suffer so horribly if they catch the flu. You can't kill off those spontaneously formed cancer cells as well, so your risk of developing cancerous tumors increases also. Now, within the thymus, there is something called the blood-thymus barrier. The capillaries within the thymus are actually ziplocked with tight junctions. So between all the endothelial cells, you've got tight junctions, so that you really greatly restrict what can actually move from blood and into the interstitial fluid of the thymus. And this is important because you want to isolate developing lymphocytes from blood-borne antigens. It would interfere with their ability to develop into mature functional T cells. Now, as I mentioned before, your thymus is where your T cells are going to mature, where they're going to become immunocompetent. And this is a multi-step process. The process begins with your reticular epithelial cells secreting hormones that are going to stimulate your T cells to develop surface antigen receptors. Now remember, receptors are proteins. And these receptor proteins can recognize the antigens that are presented by your antigen presenting cells. So you have to have receptors capable of recognizing your APC in order to stimulate the T cell to function. Now, if T cells fail the RE test, the reticular epithelial test, they are going to be eliminated by what is referred to as negative selection. Negative selection means that if these cells fail, they'll either be killed by phagocytosis, or the cells will remain alive in your thymus, but will remain unresponsive for their lifetime. Now, there are two ways you can fail. One way to fail is the T cell's inability to recognize your body's MHCs, major histocompatibility proteins. The MHCs are what you have on the surface of the antigen-presenting cells. So if a T cell is supposed to recognize the antigens on an APC, it has to be able to recognize these MHCs, these major histocompatibility proteins. If you can't recognize your body's MHCs, there is zero possibility for that T cell to mount an immune response. So if you can't mount an immune response, you're going to be negatively selected. You also don't want T cells that will react with self-antigens. Self-antigens are the antigens that are present on the surfaces of all of your healthy body cells. So basically, you don't want T cells that will attack your healthy cells. So if a T cell has antigen receptors that are going to attack you, they are going to be eliminated by negative selection. Now, if the T cell makes it through the RE test, meaning the T cell can recognize your MHC proteins and it doesn't react with your healthy cell's antigens, it's going to undergo a process called positive selection. And in positive selection, you are going to form clones, clusters of identical T cells that all respond to the exact same antigen. And what you're going to create is a naive lymphocyte pool. This pool is a collection of identical T cells that are all immunocompetent, but have never encountered a pathogen before. These cells are the cells that are going to leave your thymus, migrate to your other lymphatic tissues and organs, and take up residence there. So that if the pathogen comes in and gets to a lymph node in the inguinal region, you've got the ability to recognize the pathogen there. And then some of the cells might go to lymph nodes in the axilla, so if the pathogen comes in the upper limb, you'll have T cells that can recognize it and mount an immune response there as well. Now, your thymus also produces hormones. The major hormone is called thymosin, but other signaling chemicals are formed as well. Thymosin and these other signaling chemicals help to promote the development and action of the T cells within the thymus. They have also found that thymosin is anti-aging. So it won't surprise me if the cosmetics industry starts to try to look at applications for thymosin in preventing age-related changes within the body. Now, if you think about that and the fact that your thymus dies over time, what happens as you get older? Do you stay nice and youthful the way you were when you were 20, when you're 60? No, you see sagging skin, you see wrinkles, you see gray hair. And there is a theory of thought that during this period of time, as you are getting older, your thymus is dying, it is producing fewer T cells, but it's also producing less thymosin. And thymosin is a hormone. It can enter your blood and travel throughout the body. So if you have less thymosin at the same time, as you now start seeing the signs of aging, it's very easy to connect the dots that the loss of that hormone could be playing a role in the developing signs of age. So it'll be interesting to see where research takes this in future years. Now, your tonsils are our next lymphatic organs. Your tonsils are located at the entrance to your pharynx, and the pharynx is your throat, right? So this is a little area called your throat, and they're going to be there to help guard against pathogens that you have ingested and pathogens that you have inhaled. Your pharynx is actually the single passageway that's used to pass air from your nasal cavity down to your trachea, your main airway heading to the lungs, but also to take the food that you swallow and move it into your esophagus. So the pharynx is doing double duty in two different systems. So if two great ways for pathogens to come in is breathing and eating, or breathing and drinking, you definitely need to have some safeguards in place in this location. Now, you do have a pharyngeal tonsil. The pharyngeal tonsil is located in the superior pharynx, just posterior to the nasal cavity. You might have heard of it referred to by its nickname, the adenoid. However, its official name is the pharyngeal tonsil. You then have the palatine tonsils. You have them on the right and left sides. They are in the lateral posterior margins of the oral cavity. So if you've ever heard of someone having their tonsils out, it's the palatine tonsils that have been removed. You also have lingual tonsils located at the base of your tongue. So they're in the most posterior portion of the oral cavity. Now, your spleen is actually the largest lymphoid organ, and it's going to be positioned between the lateral border of your stomach and your diaphragm. Now, your spleen is very, very, very blood rich, which is why if you have damage to the spleen, you can actually hemorrhage very severely, even from very small damage. Now, the spleen is composed of two types of tissue. You have red pulp, which is where you have some venous sinuses with lots of red blood cells. So the red pulp is very vascular. You also have white pulp, which is where you are going to find lymphocytes and macrophages, and they're kind of positioned like little sleeves along branches of your splenic artery. Now, the spleen performs many different functions. It will give you some temporary red blood cell storage. It is one of your two sites for red blood cell destruction. You learned about that function in Chapter 18 when we talked about red blood cell recycling. In addition to destroying red blood cells, your spleen has a lot of phagocytes, so it has the ability to destroy other components as well by phagocytosis. It is capable of storing iron, so eating the spleen of an animal, I'm not big on eating the whole internal organ thing, but if you need to eat something rich in iron, liver and spleen, two really good areas. Your spleen also stores 25% to 40% of your body's platelet supply. So if you do have an injury to your spleen and it is removed, and you start thinking about what could that mean for that individual after they've recovered from the surgery and are continuing through their life, they now actually have impaired clotting because they have lost the organ that has the ability to store that extra platelet supply. They are important for the initiation of your immune responses. You've got a lot of lymphocytes in here, a lot of macrophages that help to monitor your blood for foreign antigens. So people who don't have their spleen actually need to be very careful around people who are sick because they are more susceptible to getting ill. And I know this is a fact because my aunt had part of her pancreas and her spleen removed because they found a small cancer nodule in the tail of her pancreas. So, now that her pancreas is gone, she does get sick more easily, and once she is sick a lot longer. So the recovery period, it takes longer. You can have your spleen serve as a reservoir for monocytes. So you have some extra monocytes stored in here, and this is just in case of an emergency. If you have a microbial infection, myocardial infarction, a heart attack, if you have any gaping wounds, you actually have this backup reserve of monocytes that can help combat the pathogens that come in, but also get out to those tissues to help repair the damage as well. Your spleen also helps to stabilize blood volume. You can actually use your spleen to transfer excess plasma from your blood and into the lymphoid system this way. So you can actually do that as well.